I'm the General Manager for the Children's Hospital, and I'll be chairing today's Muddle. If anybody has any comments or questions, then do pop them into the chat as we go along, and we'll collate them and address them as we can at the end, as we always do. We really do want to hear from you, so if you do have anything, please do feel free to pop that into the chat. Okie dokie. So Linda Pollard, our Trust Chair, attended the tactical Q&A on Friday because it was such a significant day following the death of the Queen. And reflected on how very sad everybody was feeling, and in terms of feeling very reflective over how the death of Her Royal Highness the Queen had affected everybody and will continue to do so. Dame Linda acknowledged how the Queen was the ultimate professional in her job, and her duty to public life was a top priority, and something that we can absolutely identify with in terms of the roles that we all take place in within the NHS. Linda wanted to join the tactical Q&A to support Julian and the staff and the teams and everybody really to acknowledge it. So I think it was really nice for Dame Linda to come along on Friday morning to say that. She also said that, like the Queen, we need to be ultimate professionals and we need to be getting on with the job just as she would have done and would expect people to do. And that is absolutely what everybody has done. If anybody does need support, reach out. There are details on the Health and Wellbeing website on how to get help and how to talk, or just speak to a colleague or your manager or anybody. Things like this can be very triggering, can't they? And they bring up all kinds of feelings that we've felt from other kind of losses in our lives, so it can make things really difficult. So do not be afraid or ashamed to reach out, because that's what we're there for. We're all there for each other. Julian was also at tactical Q&A, and he reflected that as a trust we're really well supported by the royal family, and we enjoy the patronage of the Countess of Wessex for the Children's Hospital. And of various royals visits over the years to many of our services. In fact, we had one. The Countess of Wessex was due to come tomorrow afternoon, which understandably and absolutely appropriately will now be postponed. But we do have really close connections, and the support that we feel as a children's hospital from the Countess as our patron is second to none. Julian shared his own personal recollection of meeting with the Queen in 2015, when Celia and Julian were invited to Buckingham Palace by the Countess of Wessex and Prince Edward for an evening reception for the charities they support. They didn't expect to see the Queen, but she arrived and came over to talk to Julian, asking all about the work in the Children's Hospital and the wider hospital, and was really interested and very supportive. Julian said it was really clear that she showed a genuine interest and curiosity and had care for what we all do, which I think is really lovely. And I'm sure everybody's been hearing all the lovely stories, anecdotes, and people's memories of the interactions that they've had with her. As a trust, we've put out a note to convey our sincere condolences to the royal family, and we're making sure the chapel and prayer rooms are open 24 hours a day, and we'll host paper and digital books of condolence. So if you do want a minute just out of the hustle and bustle, or just to collect your own thoughts, do make full use of the chapels that are available on site. So then moving on to a much more operational issue in terms of where we are with COVID as an organisation. Our risk score remains medium high. There has been a reduction, but it's a bit slower than we were hoping for, but the numbers are heading down, as are the nosocomial infection rates. Plans are in place now for how to work towards winter, which we're all anticipating is going to be very challenging, but move forward and plan we do nonetheless. In terms of IPC, they're working on a decision management tool for dealing with various types of outbreaks that we're fully expecting, and we all know there are different strains popping up all over the place. But as an organisation, we need to be clear about how we manage and preempt those kind of outbreaks and be proactive in terms of the actions that we'll take, and that will really help with rapid decision making in the challenges that we're undoubtedly going to expect this winter. So that's it from tactical. Laura, if I pass over to you for operational pressures in the week ahead.
Yeah, no problem. So good morning, everybody. I'm Laura Whelan, the Deputy Head of Nursing, if we haven't met each other before. So we remain pressured across our PEDS crit care area. We did unfortunately have a number of cancellations last week across PEDS crit care due to bed being fully at bed capacity and also some staffing challenges. The good news is I've just done the introduction to professional practice for our new starters, and so there's I've met a whole host of both newly qualified staff, but staff that have also joined us from other trusts that have got a couple of years of experience. So I feel that we're beginning to see some new nurses entering the bed base now at this time of the year, which is always really good. That takes the pressure off a little bit. And then from a surgical capacity perspective this week, we know that unfortunately we've been hit by COVID across staff members in our surgical area, so that's just proving a little tricky for us to manage this morning in terms of what capacity we have and what we'll have for the rest of the week. So we are working through that. So that's probably the two areas that we anticipate being challenging this week. Suzanne.
Thank you. Sorry, mic off then, I'm chatting away. Thanks, Laura, that's great. So going on to finance then. So we've just submitted our latest forecast. Again, I know loads of people hear this, but for those of you who don't, a forecast is where we submit to the Director of Finance where we think we'll be from a financial point of view at the end of the financial year. So how much money we have to spend and how much we think we're going to spend, essentially. Last month we submitted a forecast of being 1.3 million overspent. That puts us in an amber position, and this month that we are putting in a similar forecast of 1.3 in an amber position. However, we've had a number of things that deteriorated our position through operational difficulties and things we weren't expecting to happen that had a cost implication happening. But we were able to offset that with the additional waste reduction that we have found, and also something we were expecting to have to pay for that we didn't have to pay for has offset that essentially. So that remains us at 1.3 million and in an amber position. We absolutely have got to chip away at that and reduce it down so we get to a green position, which is being balanced essentially. So we spend what we're given and no more. And we continue to do that through the fantastic waste reduction programme that Liz and Kirsty as our quality improvement leads work on each and every day. So again, just a plea, no idea too wacky, too small, anything will be considered because it all adds up and it is all adding up to a very significant amount of money. And speaking of waste reduction, can I pass over to you, Liz?
Thanks, Suzanne. Morning, everybody. Just another nice little example this morning of where we're saving some more money. So hopefully you're all aware of the rollout of Patient Hub, which is a new app for communicating with patients. We recently successfully piloted it in sending out patient appointments for some of our specialties. I must add that the app is capable of a lot more than just sending an appointment letter, but I think that'll be presented elsewhere. So using it for 7 specialties in a 8-week phased rollout. So it wasn't used for the whole 8 weeks in all those specialties because it was a phased rollout. And this alone saved us approximately £550 on postage costs, as the app removes the need for paper appointment letters for most patients. So following the success of the pilot, it's being rolled out more widely across children's CSU and indeed many adult CSUs as well. And we expect within children's about £10,000 worth of postage savings throughout the year when it's fully implemented. In addition to the benefits of reduced use of paper, reduced printing costs, and reduced transportation of paper letters. So there's a nice environmental impact there as well. However, much more importantly, it allows us an opportunity to improve the quality of our communications with patients and their families. And one of the really important things, this includes options for translation into quite a number of languages of those appointment letters and the details that go with them. So I think that's going to be a bit of a game changer and a real massive improvement for many families. And yeah, so in addition to sort of just a standard appointment letter, we're also able to send other documents alongside that appointment via the app, you know, clinic specific supporting information or anything else that we want to do. So I think you'll hear a lot more about the benefits to both patients and services as the rollout progresses. But yeah, it feels like a really great step forward.
Brilliant. What a wonderful example. Thank you, Liz. Appreciate that as always. Okie dokie. So we're going to have, it's a good lessons learned that we're going to share with you. Laura, I believe you're going to share this.
I am. So You may or may not remember there was an incident a couple of years ago where a child was scalded by some hot water on one of our ward areas. As a result, one of the interventions that was taken was to remove any sort of kettles from our ward areas. And then recently it's come to light that out of hours, staff have been struggling to make up milk feeds and had previously been using the sterile water in the small 90ml sterile water bottles to help them to do that as an other option to sort of cool boiled water. And there's some recently released guidelines around how to prepare milk feeds by the NHS, their national guidance, and that has actually removed our capability to be able to make feeds up in that way out of hours. Obviously we use our milk kitchen as much as we can. And so as a result of that, we've had to put some quite rapid interventions in very quickly around how we can safely now begin to prepare feeds locally at a ward level using boiling water again. So just a little bit of information sharing really to say that this week you will see kettles go back into the ward areas, but they will be behind a locked door. So we'll be using the ward kitchen, the locked ward kitchen, creating some milk feed preparation stations within there. And we've had great support from Helen Harrison and Lisa Henry, who are our dietetic colleagues, who are helping to draw up an SOP and some guidelines for staff. So I think more to come on that, but just to make everybody aware that that is a significant change really that's happened in the last 7 days, and that we should not be using those 90ml water bottles, the sterile water bottles, for any milk feed preparation across the Children's Hospital. Thanks, Suzanne.
Thanks, Laura. So in terms of sharing success, it's a bit of a loose link this, but this is, hopefully people can see the screen. This is a financial wellbeing newsletter that another CSU did, but they shared how well received it had been, so we wanted to share it with you. There will be a link to the newsletter in the chat, Ed, if you could pop that in there. But basically it's just signposting people, very similar to how the health and wellbeing information and resource did, to resources that may help people through these really tricky times. So there's various websites to be guided to. So Money Buddies, which is a health and wellbeing recommended free resource, and it's a website that will be able to discuss some potential hints and tips on how to save money and help with bills. There's advice regarding government tax code changes for those who aren't aware of that, but if you meet certain criteria, there's an opportunity to get some tax relief. There's how to access the financial informative page for financial wellbeing within the trust. Money saving expert Martin Lewis, who I listen to as much as I possibly can about all kinds of things, but particularly at the moment, is fantastic, that website. So do have a look there and click on some of these links. And the blue light card, as well as an NHS employee, I think it's £5 for the blue light card for a year, and you do get a whole host of savings on various different things. I literally got one of them last month and it's brilliant. So there's lots of things in there for people to be able to have a look at and see, even if it's just one thing that helps, it's one thing, isn't it? And as I say, it's a bit like weight reduction, it all does add up to make a difference in the end. And anything that makes a difference at the minute will be well received, I'm sure. And then the other thing that's been put into the chat is a link regarding a support fund for patients and visitors. So I know that we're having quite a few families feedback that they're struggling to be able to afford the transport to get in for their child's appointment or procedure. And there is a specific patient and family support fund that's available, and that if you click on the link that's in the chat, people will be able to work through how to access and support those kinds of circumstances. It is really difficult, and extra resources are coming online all the time, so just keep your eyes open and ears open, and we'll make sure that we keep you fully informed as and when we hear about things that could potentially help. Okay, so that brings us to the end of what we're going to go through today. In terms of the chat, Ed, have we had anything?
Just one question, but I believe Liz already answered it. It was just around training. I think Liz has taken care of that. So no other questions. Okie
dokie. Well, as always, thank you so much for spending the time to join us on a Monday morning. It does mean a heck of a lot to us within the Triumvirate that you do. So, oh, I've just seen a hand pop up. Kathleen.
Hello, yes, sorry, just me. It's Kathleen. I'm the Quality Improvement Clinician for Learning Disabilities and Autism. And I just wanted to say quickly, as a bit of any other business, I don't know if anybody's heard about our care bag pilot that was in ED for adults with learning disability. So it's a little tote bag that's got some sensory stuff and some easy read information in that's given to any person with learning disabilities or autism. We've been piloting it for the last 6 months with adults, but we're in a position now that it can be rolled out to peds. So lots of peds have already received it, and it's just to help people manage their environment in the A&E department. So there's eye masks, ear defenders, all sorts of things in there for them. But yeah, it can be given to peds now.
Wonderful. That's fantastic. What a perfect thing to share on the Muddle. That's exactly what we're here for. So that's wonderful. Thank you so much.
Kathleen, could you contact me about that, please, and we'll see if we can share it more widely.
Yeah, that's a great idea.
Yeah, we'll do.
Perfect. Wonderful. All right then. Well, thank you ever so much, everybody. Again, really appreciate your time this morning. Have a good week. And if anybody is struggling out there, please do just reach out.
Suzanne, I'm sorry to interrupt, but we just have one more question drop in.
Yes.
Just pertinent to next Monday bank holiday. Catherine Crowe has just asked, with Monday being a bank holiday, are trust inductions and study days still going ahead?
I fully anticipate, I anticipate that next Monday will be treated as per any other statutory bank holiday. The execs are meeting as we speak to confirm if that is the case or not, because aside from everything else, there's 160 patients booked to have the procedures on Monday. However, all schools will be closed, so we're just trying to work that out. So something will come out from the trust as soon as that decision's made. It's literally being discussed as we speak.
Thanks, Suzanne. There's a similar question from Susan Johnson, but I think you've answered that as well. So something will come out from either the trust or we'll send something out as soon as we know.
I think probably both. Yeah. All right then. Thanks ever so much, everybody. Have a good week and support each other. Thank you. Bye.
Bye.
Thank you.